All right. Hello, everybody. Happy video number 2 for January, and we are starting on page 200. I like that. We are talking about blood and the cardiovascular system. Super important. So, blood, specialized life sustaining body fluid. It is so important. It's what keeps us all going. It has four main components: plasma, red blood cells, white blood cells, and platelets. The blood that runs through the veins, arteries, and capillaries is known as whole blood. It's a mixture of approximately 55% plasma and 45% blood cells. About 7 to 8% of your total body weight is blood. Super cool. Blood supplies your body's cells and organs with oxygen and nutrients. It helps regulate body temperature. It fights infections and removes waste products. Super important. An average sized man has about 12 pints of blood in his body. An average sized woman has about 9 pints. Okay? Functions of blood: transporting oxygen and nutrients to the lungs and tissues. This is done via red blood cells. White blood cells carry cells and antibodies that fight infection. Okay? Platelets form blood clots to prevent excess blood loss. So when you have like a scab or something, that's the platelets working hard to prevent you from bleeding. It also helps bring waste product to the kidney and liver, which then filters and cleans the blood. It regulates body temperature and heals after an injury through platelets. Important. Please be aware that students who take daily aspirin or blood thinning medications, anticoagulants, may not have the same clotting ability as other students, which means they may bruise more easily from certain tools like lacrosse balls, the yoga therapy balls, foam rolling, or even hands on. Just something to be aware of. Where do blood cells come from? Blood cells develop from hematopoietic stem cells and are formed in the bone marrow through highly regulated process of hematopoiesis. I'm not a medical doctor. Stem cells can differentiate into red and white blood cells and platelets. And these stem cells circulate in the blood and bone marrow in people of all ages, as well as in the umbilical cord of newborns. So cool. Stem cells from all three sources may be used to treat a variety of diseases, including leukemia, lymphoma, bone marrow failure, and various immune diseases. Moving on, page 201. Blood vessels circulate throughout the body, and they help deliver oxygen to vital organs and tissues and remove waste product. They regulate your blood pressure as well, and your blood vessels include veins, arteries, and capillaries. Each type serves a purpose in your body. We'll go into those. Blood vessels are channels that carry blood throughout your body. They form a closed loop. This is so cool. Like a circuit that begins and ends at your heart. Those are the blood vessels, and they together, your heart and blood vessels form your circulatory system. So I like to show, before we keep going, the bone marrow image so you can see all of those stem cells and what comes from them. All right, that's page 201. So what do blood vessels do? So remember, blood vessels are channels that carry blood throughout the body, and they form a closed loop, and it begins and ends at your heart. All right, so what do blood vessels do? They deliver blood to the organs and tissues in your body, and blood supplies them with the oxygen and nutrients they need. Blood vessels also carry waste products and carbon dioxide away from your organs and tissues. Each type of blood vessel serves a different function. We're going to go into those now. Let's take a deep breath. All right, blood, so fun. Arteries. These are strong muscular blood vessels that carry oxygen-rich blood away from your heart. Arteries away from your heart. And this blood contains oxygen from your lungs, okay? Arterioles, similar to arteries, these are smaller branches that extend out from the arteries as they move towards your tissues. These are very flexible, and they can get bigger or smaller depending on your blood pressure, okay? Capillaries are your smallest blood vessels, and these connect arteries and veins. Because of their thin walls, they are transfer stations for oxygen, nutrients, carbon dioxide, and waste. They can go in and out. Venules are small veins. These receive blood from the capillaries and lead to veins. Finally, veins. These are blood vessels that carry oxygen, poor blood, back to your heart. From there, it goes to your lungs for more oxygen. All right? So if you think about it, arteries, oxygen rich. They go arterioles and then capillaries and then venules and then veins and back up and around. All right? Whew. The cardiovascular system. It consists of, so we're on page 202. It consists of the heart, blood vessels, and blood. It functions as a central transportation system within the body. At a high level, its job is to transport blood, which in turn carries oxygen, nutrients, and hormones to the cells. It also carries away waste, carbon dioxide, in a continual cycle. Your heart is located in between your lungs, in the middle of your chest, behind and slightly to the left of your breastbone/sternum. The way I always remember what side the heart is on is when we do Pledge of Allegiance or any type of pledge, you're placing your right hand over your heart. So the right hand is going across the body. That means the heart is on the left side. The heart weighs between 7 and 15 ounces and is a little larger than the size of your fist. By the end of a long life, a person's heart may have beat, expanded, and contracted more than 3.5 billion times. In fact, each day, the average heart beats 100,000 times, pumping about 2,000 gallons of blood about 35 million times a year. Wild. Okay. A double-layered membrane called pericardium surrounds your heart like a sack. Pericardium is around the heart like a sack, so like a pillowcase. The outer layer of the pericardium surrounds the roots of your heart's major blood vessels and it's attached by ligaments to your spinal cord, your diaphragm, and other parts of your body, okay? So the heart is connected, diaphragm and spinal cord, which is one of the reasons why, especially if you're fast breathing and your heart's working really hard, sometimes that can actually cause back pain. So this is related. Your heart has 4 chambers. The upper chambers are called the left and right atria. The lower chambers are the left and right ventricles. Atria, ventricles. A wall of muscle called septum separates the left and the right and the left, okay? The left ventricle is the largest and strongest chamber in your heart. Its walls are only about a 1/2 inch thick, but they have enough force to push blood through the aortic valve and into your body. I'm going to take a sip of coffee. So, I'm going to take a second. If you're walking or driving, you don't need to look. But if you want to have a second, you can look at this diagram on page 202. We're going to talk about it right now. All right. So, to help you remember which comes first, A comes before V in the alphabet. Therefore, blood will flow into the atria on top, then down to the ventricles to be pumped out either to either the lungs or the body. Okay? The heart valves. There's 4 valves that regulate blood flow through your heart. So 1, the tricipit valve regulates blood flow between the right and left atrium. Pulmonary valve controls blood flow from the right ventricle to the pulmonary arteries, which carries blood to your lungs to pick up oxygen. The mitral valve, and this is all if you look at it on page 202, lets oxygen-rich blood from your lungs pass from the left atrium into the left ventricle. And the aortic valve, remember, opens the way for oxygen-rich blood to pass from the left ventricle into the aorta, your body's largest artery. Okay? So as a reminder, A before V. The blood flows into the atria on the top, down the ventricles, all right? Another reminder, a nice way to think about all this. Right returns, left leaves. This is the blood through the heart. Right returns, left leaves. So the right chambers collect returning deoxygenated blood from the rest of the body. All right? Right atrium. And they send it to the lungs, right ventricle. So right returning. So the blood that's coming back from the rest of the body that doesn't have oxygen is going to go into the right atrium and then into the lungs through the right ventricle. While the left side chambers collect the oxygenated blood that is left the lungs. Left leaves. This is through the left atrium and sends it out the body through the left ventricle, which we learned is the largest and strongest chamber of the heart because it pushes the blood through the aortic valve into the body. All right? So right returns, left leaves. Page 203. All right. Electrical impulses from your heart muscle, myochondrium, cause your heart to contract. The electrical signal begins at the sinoatrial node, SA, located at the top right atrium. The SA node is sometimes called the heart's natural pacemaker. An electrical impulse from this natural pacemaker travels through the muscle fibers of the atria and ventricles, causing them to contract, okay? Although the SA node sends electrical impulses at a certain rate, your heart rate may still change depending on physical demands, stress, and hormonal factors. So important. How does the heart work with other organs? It works to help the body control heart rate, blood pressure, and other body's functions. So the circulatory system, all right? The heart and circulatory system make up the cardiovascular. This is kind of like taking a step back, little overview. The heart works as a pump that pushes blood to the organs, tissues, and cells through the left side, okay? So remember, right returns, left leaves. Blood is returned to the body through venules and veins. It is carried to the heart and the rest of your body through arteries, arterioles, and capillaries. Whew. All right. If all the vessels of this network in your body were laid end to end, they would extend for about 60,000 miles, which is enough to circle the entire earth more than twice. So fucking cool. So, the nervous system. How does the heart work with the nervous system? We just talked about the nervous system in January video number 1 if you watched that first. The nervous system, as we know, the CNS and the ANS, originates in the brain, controls movement, thoughts, other body systems, and processes. The nervous system helps control what? Heart rate by sending signals to the heart when to beat faster or slower, such as during times of stress and rest. The sympathetic and parasympathetic nervous system. See how it's all coming together, my friends. During exercise, the sympathetic nervous system sends signals to the heart to increase the rate of conduction to meet the oxygen demands of the body. Because remember, the SNS is going to help open airflow and help increase sweat production and help increase muscular contraction and so forth. When activity intensity is reduced by the parasympathetic nervous system, it's responsible for slowing the rate of conduction. So fucking cool how they work together. Next up, so we did the nervous system. Now, how the heart works with the endocrine system. So this is what is made up of glands that create and release hormones that control nearly all the processes of the body. These hormones tell the blood vessels to constrict or relax, which affects blood pressure. Hormones from the thyroid gland can also tell the heart to beat faster or slower. And as you might remember from the last video, if you happen to watch it, about the nervous system, the hypothalamic pituitary adrenal axis, the HPA, is linked to this autonomic nervous system and plays a crucial role in stress response through the release of cortisol, stress chemicals. That's hormones in the endocrine system. And that is connected. Problems with these systems, with any of these systems, can affect the heart and lead to cardiovascular disease. For example, diabetes is technically an endocrine disorder that develops when not enough of the hormone insulin is made, or when insulin in the body does not work as it should. Diabetes is a major risk factor for cardiovascular disease and can cause damage to the nervous system. Everything's connected, my friends. All right. We still have some time. Let's keep going. We're on page 204 if you're following along. Understanding heart rate. Heart rate simply is the rate at which your heart beats. Cardio output is the volume of blood pumped by the heart per minute, and it's a function of heart rate and stroke volume. So fucking cool. When cardio output is about 5 liters to minute at rest, it may increase as high as 30 liters per minute during vigorous exercise. So that's how much it's actually pumping out. During exercise, the hope is that over time, the heart will become stronger, an increase in stroke volume, while this will allow the heart to maintain the same level of circulation at a lower heart rate. So this is why if you take a vinyasa class every single Tuesday for 6 months, over time, the cardiovascular and the muscular portion get easier in many ways because your body's adapting. That's fucking cool, which is why then if you want to keep adapting and getting stronger, you have to continue to add in new challenges. Maybe you hold plank a little longer. Maybe you add in yogi push-ups and so forth. Resting heart rate, RHR, is also known as your pulse, and it's the number of times the heart contracts per minute while at rest. Resting heart rate ranges can vary dramatically depending on age, size, gender, health, fitness, and status. And fitness level. On average, for an untrained adult, an average resting heart rate is approximately 60 to 100 beats per minute. Heart rate increases in response to exercise, physical activity, stress, remember sympathetic nervous system, and it lowers during parasympathetic nervous system, rest, sleep, and relaxation. Now, blood pressure is the force of blood pushing against the walls of your artery as your heart pumps blood around your body. So as a reminder, going back to how your heart works, atria, ventricles, atria on top, ventricles on the bottom. Right returns, left leaves, okay? So right is when the deoxygenated blood is coming in, left is when the oxygenated blood is going out to the rest of your body. Just bringing it full circle. Blood pressure is a measurement of how well your circulatory system is working and is measured in millimeters of mercury. A blood pressure reading has 2 numbers. Systolic, the top number. This measures the pressure your blood is pushing against your artery walls when your heart beats. Diastolic is the bottom number. And this measures your blood is pushing against your artery walls while the heart is resting between beats. So your blood, the pressure is still going against your artery walls. There's always pressure. It just depends on how high that pressure is when it's actually contracting and beating or when it's at rest between those contractions. All right. Either a high systolic or diastolic reading may be used to diagnose high blood pressure. Whew. As people get older, their systolic blood pressure usually goes up because of large arteries that become stiffer. There's more plaque buildup over time, and unfortunately, higher rate of heart and blood vessel diseases. Let's wrap this up. Hypertension versus hypotension. Hypertension and hypotension are opposites, and they relate to blood pressure. Hypertension is high, hyper, like a hyper kid, high blood pressure. It occurs when the force of blood against the artery walls is too strong, okay? Hypotension is low blood pressure. So not only can you remember hyper, like a hyper kid, high intensity, or low blood pressure occurs when there isn't enough force of blood pressure, okay, against the artery walls. Whew. High blood pressure happens when the force of your blood pushing against the walls is too high and can lead to other serious problems, such as a heart attack or stroke, and it can affect anyone. I will say a lot of the time, like I said, for the blood pressure issues, you see a lot of this as people grow older because of dietary, lifestyle, exercise, health conditions, hereditary conditions, and so forth. Hypertension is categorized into stages based on blood pressure readings, and these help guide treatment decisions and assess the risk of cardiovascular complications. All right, so I'm not going to go into all of that, but essentially there's different levels of hypertension, which makes sense. So moving on, hypotension is where it's lower, as a reminder, and potentially reduces blood flow to vital organs. So some individuals may have naturally low blood pressure without issues, and some may have issues like dizziness, lightheadedness, or fainting when their blood pressure drops too low. Severe hypotension can actually even lead to shock and requires immediate medical attention. Whew. Defined as low blood pressure is a reading of 90, the systolic, over 60 diastolic, according to the National Heart, Lung, and Blood Institute. Common symptoms of low blood pressure: dizziness, lightheadedness, fatigue, blurred vision, nausea, fainting, and confusion. Severe symptoms: cold, clammy skin, rapid breathing, blue skin tone, and weak, rapid pulse. Possible causes: possibly dehydration, deconditioning, pregnancy even, and certain medical conditions, and medications. Heart problems, endocrine disorders, infections, and so forth. There's technically 3 types of hypotension. I'm not going to go into those right now, but that's on 206 if you want to read about them. Wrapping this bad boy up, we're going to go into understanding cholesterol and heart health. So finishing up our blood and cardiovascular. So if you're following along, we are just skipping yoga and blood pressure, and I'm going to come back to that. So we're on page 207. Low density lipoprotein cholesterol, LDL, carries cholesterol to cells throughout the body. High density lipoprotein cholesterol acts as a scavenger and collects excess cholesterol from the bloodstream. It carries it back to the liver where it's processed and removed from the body. High HDL levels are associated with a lower risk of heart disease. We like high HDL, okay? HDL is the good stuff. LDL levels, though, are when they're high, cholesterol can accumulate in artery walls, forming plaque. This plaque buildup narrows arteries, restricts blood flow, and can potentially lead to heart attacks or strokes. So low is bad. We don't want LDL to go high. We do want high DL. So that's how I always remember it. High DL. And I remember when I did my NASM test, one of the ways I also remembered this was because it was really hard for me to differentiate between the two. But someone said to picture HDL as a friendly, hi, they're waving to you, cholesterol. All right, that's just my way. Heart conditions. We're going to come back to that. So this is our perfect time to, you know what? I think we can do it. Heart conditions. So cardiovascular disease, CVD, is the world's leading cause of death and disability. So fucking sad. The main underlying cause of CVD is atherosclerosis, the buildup of fatty plaques on the walls of arteries. That's what we just talked about with LDL. We don't want LDL. These plaques are made up of fat, cholesterol, calcium, and other substances. And as they harden, as I talked about, they narrow the opening of arteries, restricting blood flow. And they can cause blood clots, which can further limit or even block the flow of blood throughout the body, causing heart attacks and strokes. Are we seeing a pattern, my friend? CVD refers to all diseases of the heart and circulation, including arterial fibrillation, which is a common irregular heartbeat, which is linked to 1 to 3, that is linked to 1 to 3 strokes. Coronary heart disease is one that I definitely have had the most amount of clients and students that have had, which is another common condition where major blood vessels to the heart, the coronary arteries, become blocked and narrow, and they restrict the flow of oxygen-rich blood to the heart. Diabetes, which we talked about the insulin already. Heart attack, which occurs, in case we don't know this, when the heart is deprived of oxygen due to a blocked artery, and it can lead to death if not treated immediately. It's also known as a myocardial infarction. Heart failure, which is when the heart does not work as well as it should in pumping blood and pumping blood and oxygen around the body, and this can actually lead to death, and immediate medical assistance is required for heart attacks and heart failure and strokes, which occurs when the blood supply to the brain is cut off, such as by a blood clot blocking an artery, and it can cause huge issues. We know this. There's been a lot of health awareness around strokes, I believe, since I was a kid at least. They even had signs on the side of the highway to know what to do if you see a stroke. So what's important for yoga and for as a fitness professional is if there's ever a situation where you are concerned, or a student or another student is concerned that there is someone in your class having a heart attack, a stroke, or even heart failure or anything like that, call 911 immediately. Do not let that person leave. Obviously, you can't restrain somebody, but you are responsible for that person and their health and wellness. So first and foremost, call 911. And then as a yoga teacher, you cannot teach without being CPR certified. We have an AED at both studios because this is crucial and so important. So you would follow along the AED guide, and you would do essentially what it says if somebody does go into a cardiac failure situation. This is very, very, very important, okay? So first and foremost, call 911. Obviously, if somebody is not sure or you're not sure, at least have them sit down, have them keep their head above their heart, have them maybe try taking a tiny sip of water if that's going to help, but being very thoughtful and careful because minutes save lives, my friends. Seconds save lives. Whew. How to improve your heart health? Do we have time? We do. We have 2 minutes left. So these videos have to be 30 minutes or less, or I don't have enough room on my laptop, which is crazy. I don't know why. All right. Improving your heart health. Eat a nutritious diet that includes a variety of colorful fruits and veggies, wholesome greens and proteins. Limit your intake of motherfucking processed food, my friends. They contain high levels of saturated and trans fat, LDL, the shit we don't want, salt and sugar. Avoid soft drinks and other sugary drinks. Choose healthier sources of fat. We still need fat. It's important, but we want avocados, salmon, fish, seeds, nuts. Make regular exercise or physical activity part of your daily routine. Experts suggest at least 30 minutes a day, at least 5 days a week. Maintain a healthy weight by doing everything I just listed. Limit intake of alcohol. Excessive amounts of alcohol can increase the levels of some fats in the blood and reduce levels of good HDL cholesterol and increase blood pressure. Boom. Quit smoking if you're smoking. Not necessarily weed, but quit smoking cigarettes if you do. All right, finally, I am going to come back and talk about yoga and the circulatory system and do a quick overview because we are out of time, my friends. Let's say for this one, the aortic valve is your special secret word. Aortic valve. Thank you and go team.